That's a lot of energy. I'm going to calm it down a little bit. Um, yeah, because this is a keynote, I usually like to, sort of pace up and down. But I wrote down some points so that I'm very careful that um, I don't miss anything, because it is a big responsibility that Madan has given me, and Ritu has guided me what this session is about. And so I took the time to write up some of my thoughts so I don't miss that. But yes, like Madan said, it took me an hour and 45 minutes to travel 17 kilometers. And as I was looking at it, I was thinking, what a funny topic I have, because it's really about enabling environment, to speak about enabling environment. And we don't even have the basic infrastructure in a city that is the most vibrant for startups. Don't you feel like we got a raw deal? Because let's face it, guys, you are the guys, you're the people who wake up every morning and say to yourselves, not about how much profit am I going to make, but you think about how many lives can I save today? How many people are better off because of my work today? You're the people who wake up with attention. You're the people who wake up with purpose. You're the people who don't crib about the roads because you have to keep going and you have to serve. You want to serve. You run mobile clinics in places that are unreachable. You build mental health apps where people are still whispering about depression in society. You create solutions that don't just treat the symptoms, you actually go in deeper to solve root causes. I was just talking to someone who says, we deal with root causes. Yes, you do. You deal with root causes. And yet, despite your commitment, your sense of purpose, your innovation, you're often asked to do the impossible. Travel on these roads, be there on time, and support people who need you the most. You're not just entrepreneurs. Social entrepreneurs, the word is very loaded, and one can define it the way you want. But this is how I like to think of you guys. Us guys. I don't know why I say you guys. We are health warriors. Okay, health and well-being warriors. Why is the word well-being important? Because to me, well-being is a journey. And what the health systems does is takes a sick person and makes that person healthy at that moment. But we are going to have ups and downs, and therefore well-being is a journey. So you're well-being warriors. You're not just flipping the switch from illness to health. You serve when others hesitate. You build community. This is one community. There are communities where you serve. You stay on when the other people move on. I know quite a few of you here who've tried solutions and you're not afraid to fail. You fail, you try again. Nothing brings you up. Why? Because your commitment and purpose is right there. But the truth is, passion is not enough. And we need to support us. When someone knocks us down, we need to get up again. What you deserve and what you need is an enabling environment. Not just a stage that pitches where you pitch your ideas, but a system that sustains you. So what is an enabling environment? An enabling environment is policy that supports your work and not complicates it. Many of you just don't know the pathway for regulation for your products. Capital flows to you because of your work, not just because of who you know or what family you're born in. And that your voice is heard in the rooms where decisions are made. Oftentimes, decisions are made by those who are not at all connected to your purpose. One powerful example from India where an enabling policy has actually mattered and is mattering. And I think you know all of this, so you don't need a lecture from me, but it's about the Ayushman Bharat digital mission. One of the few examples of enabling policy, right? So, mission is to create a digital public health infrastructure for healthcare. Why? Interoperability, sustains all your platforms in one place, creates a unifying regulatory platform. You can now list your services, reach new patients, you can collaborate with hospitals and other health systems right across. With the Abha Digital ID, you can access and contribute health records with patient consent, and that enables you to build something smarter, more responsive, and personalized. There are startups I noticed here, and there are those like EkaCare and Briefcase who've already tapped into this, and maybe you are also tapped into this or planning to tap into this. So when the government builds that infrastructure for you, you are able to do what you are best at, to lead. But then let's be honest about the cost when the environment does not enable you. How many of you here have seen brilliant pilots fail? Hands? Yeah, that's more than half the room. How many of you have been slowed down by outdated regulations and or limited funding? That's pretty much all the room. And then when that happens, it's not just your dream that suffers, society suffers, right? And we can't afford that delay anymore. You deserve much more than applause and kudos, and you just deserve much more than grants and fellowships. That's pretty much what is handed to us. So you deserve three things. Many more, but in this space. Flexible funding that trusts your judgment, not somebody else's judgment. Procurement systems, and I have been right in the middle of that, that allows you to sell your services to the government or hospitals. And let's be clear here, the government is the one that goes maximum to scale. So you need to be able to tap into that. Incubators and accelerators that understand public health and not just venture capital. So they understand what you're saying. I'm in many rooms where incubators, accelerators speaking in Greek, and I'm speaking in Chinese. So they don't understand public health, they can't scale your stuff, right? And the spaces of influence, you need to be in spaces of influence that where you can shape those dialogues and discussions. And you deserve a world where being a social entrepreneur does not mean burning out, it means building up. So imagine this future with me. A mental health startup led by a young woman in Jharkhand is integrated into school health programs worldwide. One example I know of, how many of you have heard of WISA? It's a mental health app? Yeah, and some of you might have used it as well. Did you know that the National Health Service of UK has adopted it? What's stopping India from adopting it? It's not their costing structure, right? We want to get to that space very, very quickly. This is not just your dream, it is our shared future. And the more we build systems that enable you, and not just inspire you, the faster we get there. We're not asking for special treatments. We're not asking for a fair ground to stand on. And we're not asking for permission. We're asking for partnership. That's what we're asking for. We're asking for partnership. So let's build that environment, have conversations with the right people, build those relationships. And thank you, everyone, for all the work that you do, really, from the bottom of my heart. Let's keep building this environment. Let's keep building our collegiality and partnership. And keep leading, guys. Keep leading. Thank you.